So on behalf of Ravindic Psychotherapy Research Institute Trust, I welcome you all. And today we are organizing one short lecture about the schizophrenia and how the schizophrenia can be treated. That will be also our discussion. And I will request Sreyoshi Madam to say a few words about schizophrenia so that everybody will be very much aware, because mental health counseling,
Yes.
this is very, very important in case of the patient suffering from some long-term disorders, and usually they are not coming out. They usually keep themselves within the four walls. So in that condition, how do you handle the patient? That is also a very important part of the tele-mental health counseling. So now it is over to Sreyoshi.
Yeah. Okay. So today is 24th May, and today we, the psychologists or those who belong from this profession, psychological profession, are celebrating today as a World Schizophrenia Day. So let me introduce that actually schizophrenia literally means splitting of mind. If we divided the word schizophrenia, two words are coming. Firstly, schizo. Schizo means split and phren means mind. Okay, and the term coined by the Swiss psychiatrist Dr. Eugen Bleuler. Okay, but actually a common myth about schizophrenia is that people suffering from it have a split personality. It is a myth, but it is not actually true. Patients who are diagnosed with schizophrenia have just actually one personality, but common symptoms of schizophrenia includes some disturbance in their thoughts, in their behavior, right? So basically common symptoms of schizophrenia include some has positive symptoms and some has sometimes have negative symptoms. So firstly, we just need to understand what is positive symptoms. Okay, so positive symptoms means actually it is indicating those symptoms that is not actually present normally in people, but abnormally present in patient with schizophrenia. Suppose positive symptoms may be some thought disturbance, perceptual disturbance, behavioral disturbances, etc. Like thought disturbances can be called as delusion. Delusion can be said that the person who has schizophrenia, who is diagnosed with schizophrenia, has some false, fixed and firm belief. They have their own fixed and firm belief, okay, and that is unshakable. Sometimes it is very hard to change their false thought because it is very fixed and firm, and with any evidence it cannot be they do not want to change their thoughts. Some delusions are delusion of grandiosity. Suppose patient feels has some superior ideas about themselves. Next, some of have persecutory delusions. Patient may feels has they are persecuted by others. Some are plotting against them. Okay, Some delusions is like thought broadcasting. They are feeling that the patient feels that their thoughts are broadcasted. Okay, and their thoughts. Another delusion is thought insertion. Insertion is sometimes patient feels that the thought is not their own. These are inserted by external object, by external any of the external factors. Okay, so thought broadcasting, thought insertion, and thought withdrawal. Sometimes patient feels that their thoughts are withdrawing by others. Okay, sometimes they have some somatic delusions. They feel that they have some pain, they are feeling some difficulties, somatic difficulties. Sometimes for example, I have seen a patient, many of that patient feels that when they are going for any medical checkup like x-ray, they feels that the ray that are passed through their bodies, they feel that that time some somatic pain like physiological any pain are injected into their body, so they are having some physical discomfort, right? So these are the common delusions schizophrenia mainly have. Sometimes the another is that perceptual disturbances. This is called as hallucination. Okay, that is obviously here I would like to say difference between illusion and hallucination. We are also familiar with these words, illusion and hallucination, right? So what is illusion and hallucination? Illusion in case of illusion, stimulus is actually there, but we are perceiving the stimulus in a false way. But in case of hallucination, in reality, normally the stimulus is not present, but in patient's reality, the stimulus is actually there. Okay, so these are the basic difference of illusion and hallucination. Illusion, in case of illusion, I must say that obviously the stimulus is there. Okay, but we are perceiving in a wrong way, right? But in case of hallucination, stimulus is actually not there, but in case of the patient are perceiving that in a false way. So there are many types of hallucination, like auditory hallucination,
ম্যাম
visual
একটু
hallucination.
উদাহরণ দিয়ে
Hello, yes Sudipta. Hello, Sudipta Mojumdar, what are you? Please say it again.
Okay, please continue.
Okay, hallucination, visual hallucination, auditory hallucination. Sometimes patient may patient can hear some like sometimes they hear some comments. Okay, even they can hear auditory hallucination can be many types. Sometimes patients can hear two individuals are talking each other, and the patient can hear their conversation, and sometimes patients can hear that somebody is commenting on their actions. Okay, so these are the auditory hallucinations. Are visual hallucinations, sometimes patient can see some object. Okay, like the room is full of cloud. Sometimes they can see god, sometimes they can see the dead person, sometimes they can see the imaginative person. These are, or there are olfactory hallucination also. They can smell some poison. Sometimes they are reporting that then I can smell poison in my room. And sometimes there are olfactory, auditory, and visual covered. And sometimes there are tactile hallucination. Tactile hallucination is sometimes patients are reporting that some insects are crawling over their hands, over their body, right? These are the tactile hallucinations. And gustatory hallucinations, sometimes they can test poison. So they are reporting that the food they are eating, these are full of poison. They can test the poison. Okay, So these are the some hallucination, and others sometimes these are some there are some behavioral disturbances are there. Okay, sometimes they show some speech disturbance, communication disturbances, like sometimes circumstantiality can be seen. Circumstantiality, what is, if you ask any question to the client with schizophrenia, they cannot they reach the goal, but before reaching the goal they sometimes add some unnecessary content before telling you the actual answer. Okay, and sometimes become tangentiality also can be seen. Tangentiality, what is tangentiality? Tangentiality is sometimes what is, suppose you are asking your patient what is your name, so instead of answering his or her name, the patient will answer she is coming from Kolkata, instead of answering their name. Okay, and in case of circumstantiality, if you ask what is your name, she will tell your she or he will tell her his or her name, but before actual goal she will tell that I am coming from Kolkata and I completed from my education from this university, and my name is this. Okay, so the some unimportant contents are also be added in sometimes circumstantial, sometimes derailment also can be seen. So what is derailment? Sometimes patients are talking some with some topic, after that they can uh, derailment, like shift from another topic, that is another topic. Okay, so these are the common positive symptoms can be seen in schizophrenia. After that, some negative symptoms are also there, like negative symptom, it indicates that those symptoms that should be present normally in people but abnormally absent in schizophrenia, like allogia. Logo means word. Sometimes people with schizophrenia, uh, while communicating, they do answer the question in very few words, even a single words. Okay, sometimes you can see abolition. Volition means willingness. Abolition is like people do not are not willing to perform their day-to-day activities. Okay, they are skipping their even they neglecting their self also. So evolution is there, elogia is there, even flat affect also can be seen. Flat affect, while they are communicating, you cannot see any physical expression. They cannot showing any physical expression. While like if we are talking, you can see that there are physical changes. While we are expressing our emotions, our thought, our facial expression. Okay, facial expression. So while if the person with schizophrenia suffering from negative symptom, and you can see the flat effect, while you are talking with a patient, sometimes they are conveying their things but without any expression. Flat facial expression is totally flat, right? And these are, and anhedonia. Hedonic means the pleasure. Hedonic means pleasure, so anhedonia means lack of pleasure. So they cannot feel what they cannot feel what some pleasure moment, even what even they while saying some their pleasurable happy moment, while communicating their pleasurable and happy moment, they cannot show any pleasure, even what the activities previously they are enjoying. But in case of, if the patient is suffering from negative symptom, in case of anhedonia, the patient cannot show any kind of pleasure while doing the task, right? So these are the symptoms are typically seen in schizophrenia. So schizophrenia, there are various differences, not various types of schizophrenia, like paranoid schizophrenia, catatonic schizophrenia, heavy phrenic schizophrenia, these residual schizophrenia, and some differentiated types of schizophrenia are also there. Okay, so what are the causes behind the schizophrenia? So I'm briefly saying about the causes. There are some neurological causes are there and psychological causes are there. Neurological causes, some neuroanatomical changes are typically seen in schizophrenic patient, like schizophrenic patient, and some neurochemical changes like increased dopaminergic activity. are seen in schizophrenic patient. Okay, and these are the common. Even findings suggest that the prefrontal cortex, dysfunction of prefrontal cortex, large ventricle of temporal lobe are commonly seen in schizophrenia. Okay, because prefrontal cortex is basically helping us decision making, judgment. These are the mainly regulated by prefrontal cortex. So these the functions are hampered in case of schizophrenia. Okay, and some psychological factors are also there. Psychological factors, what that is mainly family theory said that if the client getting double bind messages from their parents, okay, this is called doubled bind hypothesis. Okay, doubled bind hypothesis. So double bind hypothesis said that if the patient is getting conflictual information from their parents, sometimes patient receiving positive information for a particular task or same task, sometimes patient is receiving negative message from their parents, or sometimes mother is saying some positive things and sometimes is father saying negative things. Okay, so these conflictual messages induce stress in their child. So to keep away from this distress level, patient actually image their unrealistic world, imaginary world, and started showing some symptoms like schizophrenia. And there are some expressed study of expressed emotion. Expressed emotion said that if there are various kind of expressed emotion like hostility, critical comment, over involvement. So these are the very negative expressed emotions. So if this kind of expressed emotion are showing in very heightened level, then the patient will face patient will have some schizophrenic symptom. Even relapse also occur if the patient is recovery stage. But if if the patient family continuously expressed emotion in a criticize for their condition, sometimes family members criticize their families, the patient, that you are the only responsible for my for this situation. Okay, sometimes hostility are expressed, sometimes over involvement means patient family member are saying family member becomes so guilty. They feels that these are only responsible for the condition of this patient right now. So they become over involved, they continuously over protecting the patient. Okay, so these are the kind of negative symptoms. If these symptoms are expressing exaggerately, then relapse also occur, even the symptoms also become increased. Okay, then some marital conflict between parents are also between parents are the main cause of developing schizophrenia. Okay, so these are the main family theories. Are even some like stressors are also be main cause. Stressors are also be main cause of developing schizophrenia. So I am saying this very briefly. Okay, if I'm going to intervention part is that is there are two types of intervention. In two ways we can intervene schizophrenic patient. Firstly is pharmacological treatment. So psychiatrists who sometimes psychiatrists are providing medicine, antipsychotic drug. Okay, antipsychotic drug psychiatrists are providing to their patient to control the psychotic symptoms. And whereas psychologists are try to train evolve social, try to give social develop social skills, and also intervene the family environment, because family environment is very essential part. As I'm said that in case of expressed emotion, if family continuously express their negative emotion, hostility, over involvement, and critical comment, then relapse also occur. right? So family education, family intervention is very important in this part, how to manage your how to manage the client. Okay, in case of sometimes family member feels caregiver burden also. Okay, so in that case we also train the caregiver how to manage their own distress and how to manage the patient simultaneously. Okay, and sometimes CBT can also be CBT, cognitive behavioral technique, cognitive behavioral therapy also used in case that to modify their behavior, to modify their thought, or to modify their negative emotion, so that we as a psychologist use a CBT method to intervene schizophrenia. And social skill training is very important in this case of schizophrenia. And these are, I'm just saying in briefly, these are the main things that we should keep in mind in case of schizophrenia. And schizophrenia sometimes so very cognitive difficulties. In case of, if you take mental status examination, we will teach mental status examination upcoming classes, how to take mental status examination. In case, while we are taking mental status examination of schizophrenia, we can observe that they have they their cognitive process become impaired. Okay, becomes impaired, and their thought process, their cognitive their mental process, their general intelligence, their abstraction methods are become impaired in this case of schizophrenia. So it has been when a cognitive side also be affected due to positive symptoms and due to negative symptoms. Okay, and sometimes it also be seen that suicide also be comorbid with schizophrenia, because sometimes I have seen a patient with schizophrenia with auditory hallucination. They continuously, the patient is continuously, patient can hear continuously that someone is commenting to commit suicide. Someone is continuously saying, he actually he just here, there is no one who say that they commit suicide not. He said that I can hear continuously while he was sitting in front of me. That time she also said that I can hear someone is continuously saying to commit suicide, to commit suicide. Okay, so suicide also we can see in case of schizophrenia. Okay, and these are the most basic concept about what can I say about the schizophrenia in this auspicious day. Okay, so sir, will you add something?
Thank you, Sreyoshi. You have covered the issue very nicely. You have covered the both positive and negative symptoms of schizophrenia. You have covered the etiology of schizophrenia very nicely. Thank you, Sreyoshi. I can add only two things. Number one, that is, I have applied Rabindric psychotherapy on schizophrenia, and I have received very good response from the clients. That is the number one point. And the second issue on which my student, Dr. Shivani Santosh, she is now head of the Department of Psychology, Neotia University. She did PhD under my guidance on schizophrenia, and we both conceptualized one construct, that is the cognitive self-efficacy of schizophrenia. And what Sreyoshi has told you, that is the cognitive impairment is there. Okay. And there is a difference between the cognitive impairment and cognitive distortion. Possibly in near future, you will learn this issue also. But what is important, that is the symptom severity of the schizophrenic patient, that is strongly correlated with the cognitive self-efficacy rather than cognitive the low cognitive function that is not related to. So symptom severity is highly correlated with this one. That shows that efficacy. If you in near future you will study the Bandura's model of the self-efficacy, and we conceptualized this cognitive self-efficacy of schizophrenia based upon the Bandura's model, and we observed that cognitive self-efficacy is highly correlated with the symptom severity of the schizophrenia. So these are the two humble submissions for this program. Thank you everybody for joining this short introduction and short celebration of the World Schizophrenia Day. Thank you everybody.
Exactly. So participant, I just also want, you are aware of the concept about schizophrenia. So if you want to add some points about your understanding, so you can also say. Then we can start, after that we can start our main task.
Hello ma'am, Abhishek here.
Yeah. Abhishek, yeah.
Yeah, please explain the word especially, please. Schizophrenia.
Explain the word.
Yes, schizo and phenia, this word.
Okay, I just said that schizophrenia, if we divide the word into schizo and phrenia, we can get two words, schizo and phrene. Okay, schizo means split and phrene means mind. Okay, so that's why the Paul Eugen Bleuler said that schizophrenia is a splitting of mind. But that doesn't mean that schizophrenia has a split personality problem. No, that doesn't mean.
Okay.
Actually,
Okay.
they split their reality. Okay, split reality means sometimes when they get very distressed about their real stress. Okay, so after that they cross their borderline. After crossing the
Means
borderline,
virtual life also, virtuality.
reality becomes distorted.
Yeah,
Okay,
they,
they perceive reality in a distorted way. Perceiving reality in a reality become unrealistic manner, not distorted, and unrealistic manner. They are start to perceiving that. Okay, what I am saying in case of hallucination, that I said the example now, the patient in front of me continuously reporting that I can hear a voice commenting on her that commit suicide, but I cannot hear. Now I am also a living person and I am the part of a real object.
Yeah, normal.
Okay, and
normally,
she is a real object for me. But if she can, if it is really happen, if she can hear, then I can also hear, but I cannot hear. So she is creating her own world. Okay, so this is.
Thank you.
Okay.
Actually, there are many classifications of schizophrenia. In case of the paranoid schizophrenia, their realistic orientation relatively better than the heavy-phrenia,
exactly.
catatonia, etc. In case of the catatonia, you do not find any sort of reality orientation. But in case of the paranoid schizophrenia, you will find the reality orientation is there. And there is some etiology also behind it.
Ma'am, as you have explained about schizophrenia, if a person is schizophrenic, so it will be sure that he will have delusions and hallucination as well.
Delusion and hallucinations.
Huh.
Okay, it depends. Like if the person is in case of positive symptoms, sometimes in catatonic symptoms, what can I in case of catatonic type of schizophrenia, we can see that the person with catatonic schizophrenia, they are showing disturbed behavior. Like sometimes they are showing stuporous behavior, sometimes they are showing excitement, and very acute feature is waxy flexibility, like their movement. If sometimes in case of stupor, they are, hello, Sudipta?
Sudipta, mute. Okay. Yes, I have done it.
Yeah, okay. So
okay. Please continue.
So in case of paranoid schizophrenia, you can see the both delusion and hallucination also. Okay. So paranoid schizophrenia is a core feature. The person surely have a persecutory delusion, and some in this case, the person commonly has auditory and visual hallucination. Okay. Sometimes catatonic type of schizophrenia, you can see there are some behavioral problem, behavioral disturbances, thought, speech disturbances. You can see in this case, right?
Okay, so according to you, delusions and hallucinations actually goes with the type of schizophrenia. Okay, ma'am, the two that you spoke, that was for the first time I'm hearing that when you were explaining what is your name and that patient says that I am from Kolkata. What was that word? Tangentiality.
Tangentiality. Tangentiality.
In which in this he doesn't gives that exact answer for that question.
Exact your name, and you will start saying that I'm coming from Jammu, I'm studying at Jammu University, instead of answering your actual name. Okay, but in case of circumstantiality, you can reach the goal, but before to reach the goal, you will say some irrelevant things. Exactly.
Okay, thank you, ma'am.
I have one question. Can I?
Yes.
Sure.
Okay. Actually, I just want to know one thing. Is there any correlation between IQ level with schizophrenia? Because why asking? Sometimes I heard from some psychiatrists that they are telling that generally schizophrenic patients have high IQ level. Is it true and scientifically proved, or it is wrong, or anything else?
No,
IQ is not the issue here, because when you are talking about the IQ, then it will be very much related to the hereditary factor as well as the maturational factor also. Because IQ is not the issue. It occurs due to broadly two factors. One, definitely environmental, that I have observed. Another one, that is the genetic factor, that is also there. Another one, brain abnormality, minimal brain damage, and there you can find out. But most of the time, what I have observed, that is it is due to the psychological stress, prolonged stress. For example, here I like to mention one case. And the patient, a young patient, when I have observed the patient long back in one polyclinic. I have treated the patient also. The interesting point is the patient is moving two fingers always. That is, the one finger is pressing another finger is pressing another finger. So this is the way the patient is doing. Initially, I cannot understand what is the movement, and I carefully observed it. And finally, I have noted that is this type of fingering is there. And then what I did, I have started the same thing in front of him. Okay. And suddenly I find smile, and suddenly I observe that is the patient, because my movement was wrong, and patient helped me to do it correctly. So can you imagine the catatonic patient? The catatonic patient, that is the diagnosed catatonic patient, and he is doing the same thing repeatedly, continuously. And finally, I explored the meaning of this hand finger movement. That is, one is pressing another one. So the finger that is used for pressing the another one, that is the truth. Okay. And the victim finger, okay, and that finger is live. So in this way, the patient is controlling the truth and lie in this world. Understand?
Okay, then he or she is trying to say that he or she is the controller of truth or lie.
Yes.
Oh my God. I have, Dr. Dotra, I have 2 more questions. Can I?
I think, I do not know whether Sreyoshi would be had any problem or not. Sreyoshi, I think Sreyoshi has some plan to finish the class. So if we talk many things, then.
So another 5 minutes we can extend our discussion. Another 5 minutes.
Okay, sure. You can say.
Just 2 simple question. Second one is, what is the difference between a schizophrenia with schizophrenoid? Cause one of my relatives has the prescription where it was written that she's schizophrenoid, not schizophrenia. So is there any difference between these 2 terms?
I have no idea.
Schizophrenoid, I guess, not schizophrenoid. It may be schizoid, like.
Yes, schizoid, no, schizophrenia.
Schizophrenoid, I think.
It was spelled as SCHIZOPHRENOID.
It should be, I think it's maybe spelled as schizoid, maybe, because schizophrenoid, this word I am not aware. Even
okay, ma'am. Then schizoid, what are you telling
schizoid.
it?
Schizoid. Schizoid is a personality pattern. Okay. Schizoid is a personality. Sometimes we see that a patient with, if we consider schizoid, okay, schizoid is a personality classified under personality disorder. Okay. So schizoid personalities sometimes show that they do not mingle with others. They unable to communicate their own emotions, own thoughts with others. Like in the class, we are sharing our thoughts, we are sharing our emotions, we are sharing our ideas with all of you. Okay, we are communicating with each other. But in case of schizoid, they are creating their own world, and they do their work. Okay, they do their daily basis work, but they unable to communicate with others. Okay, they cannot exchange their emotions. They unable to exchange their emotion. They unable to exchange their thoughts. Okay, aloof from others. Okay, but schizophrenia is a spectrum where what I have discussed, these are the symptoms are commonly seen in case of schizophrenia. Schizoid is a personality trait.
Okay, thank you, ma'am. And my last question is there any proper cure for the patient of schizophrenia, or the medicine will just make it a dormant one, just like skeleton in a cupboard, just like that? Is there any proper cure?
Cure, I should not use cure. Even psychiatry, we are not using for any disorder. You will be cured. We will be cured. We are not using this word, but what can I say? We can help to get better phase from the current phase. Okay, we try to recover, but not cure. Cure means you will gain your pre-morbid situation, pre-morbid condition, symptom-free condition. You will gain your at the fullest. But cure we will not use in psychiatric thing.
Understand, ma'am?
Because the reason is, in case of the schizoid personality disorder, there is a high probability for schizophrenia in near future. So if it is a personality disorder, it becomes very difficult to cure.
True, exactly. Personality cannot be changed. We can try to regulate, but we can unable to change personality because it is mostly inherited component, na. So this. Okay.
We can reduce the symptom severity. That we can do. we can control. That we can do.
Even
But
while I am
not
discussing the
possible.
family theories that relapse can occur for even any other disorder, depression, anxiety, relapse can occur. If stresses, we cannot tolerate the stress, okay, then relapse can also occur for any kind of disorder. Okay, so cure cannot be used from us.
Okay, ma'am. Thank you. Thank you very much, sir. And thank you very much, ma'am.
Okay. Okay. Okay, then we will move on of today's topic. Okay. Acha. Before going to our topic, I would like to say, even sir and I are discussing that this course is offering you internship, right? So we are expecting that you will do some research basis work. You can read some research paper on tele-mental health counseling. There are many papers, even thousands papers are there. Worldwide are doing their research on this tele-mental health counseling topic, effectiveness of tele-mental health counseling. Okay, so we like that you will do your own research work, and if for this research purpose you can be trained by us, by our other internal faculties also. Okay, so it will be help you to publish your research work, and you can also communicate your research other platform also. Okay, so so we are offering you to do your research and join our other things to train, to develop the skills to doing your research. Okay, sir, you want to say something?
Yeah, what you have told, that is correct, because tele-mental health issue, that is basically the post-pandemic resilience system. Okay, therefore, there is ample opportunity for publication of this research. Number one, an ample opportunity, particularly for presentation of your paper in the conferences. Okay, so on 29th May, in collaboration with the Adamas University, Ravindra Psychotherapy Research Institute Trust is going to present one counseling workshop. So please do join, and then you will learn something more. That is also the how we can teach, we can disseminate the knowledge during the post-pandemic condition.
Sir, is it in online mode or it is offline?
Online.
Okay, very good.
Our institute is virtual institute, research institute. In nearby, we will make it virtual university. Okay, continue, Yoshi.
Okay. One more thing I just want to know regarding the research purpose. Is it a case study based or it will be a review based?
Two approaches are there. One approach is the literature review that you have done. You have very good experience about this literature review. You have done it. So literature review aspect. And the second aspect, that is the collection of the data. Okay.
Okay,
And
sir.
this includes, maybe there are many tele-mental health counselors. So you can collect the data from this tele-mental health counselor. But this is not related to your practicum. Your practicum is different. That is a 10 case study. But this is for the research internship. Okay, it will be free. We will teach you, we will help you how to do the internship. You have to submit one dissertation, and we will try to help you for publication. Okay.
Okay, sir. Thank you very much. It will really helpful for us to do work in movement therapy also. Thank you, sir.
Okay.
So Yoshi now.
So moving on our today's lesson. So in previous class, we have discussed about the concept of counseling, the goals of counseling process, what are the characteristics a counselor should have during the counseling process. So today I will discuss about the process of counseling. Okay, today's discussion point on process of counseling, therapeutic alliance, and what are the differences between psychotherapy and counseling. So it will be covered by today. Okay. Firstly, actually, counseling can be conceptualized as a series of stages or steps that lead one through the counseling process. So there are basically 5 stages. First is relationship building, another is assessment, another is goal setting, then is intervention, and then is terminating the counseling session, and further follow-up. Okay. So firstly, the counseling relationship building. So here, successful outcome in counseling is associated with counselor and client relationship, which is the outcome of all counseling process effort. Okay. So firstly, as I told the previous class, that counselors should be empathetic to their client, right? So empathetic understanding as a process that involves communicating a sense of caring and understandings of patient side, right? Next is unconditional positive regard. Unconditional positive regard means counselor communicating to client that they are of value and worth as an individual. So like a depressed patient, depressed patient, like they sometimes have negative cognitive fear. When you will teach about depression, we will cover that depression sometimes create a negative cognitive fear. So what is negative cognitive fear? Negative cognitive fear means sometimes depressed patient make a negative schema about themselves, about their future, about their world. Okay. And sometimes they do not value their own self, so they are continuously feels they are very worthless. Okay. They sometimes many times they feels very helpless and hopeless about their future and create negative self image. Okay. So while doing the counseling, counselor should communicate in such a way that client should value their self in a positive manner. Okay. So it will help to create a positive relationship with your clients. Next is congruence. So congruence means similarity, right? So behaving in a manner consistent with how one think and feels. Like if you uh, what you are feeling about your counseling, you should behave in that way. This is the actual meaning of congruence, right? So how we think and how we feel, we should behave in that way. So this is the congruence process. Okay. Sometimes also another main important thing is respect. Respect, actually we should attribute our client in a positive way. We should focus on positive attributes of the clients. Okay. Because they are coming to you due to in a very distressful because they are facing very distress. They feel rejected by others. They create negative self image. Okay. They are gaining negative self knowledge. Okay. So if we if we focus on positive attributes of the client, that way we are actually show our empathetic understanding, unconditional positive regard. So this will uplift your client's motivation. Okay. If we cannot maintain all these things, dropout may occur. The client will not continue to come, cannot continue their session with you. right? So we should maintain this strategy, this attitude style. These are the actually attitude skills of a counselor should have while doing the counseling. So this kind, if you lack this attitude skills, your clients will not continue to come. The dropouts may occur. Okay. Next is immediacy. Immediacy, it's like immediacy, like it is a mutual communication. Sometimes the patients are coming to you, they want direct suggestion, direct guidance from you. So you should communicate direct manner. Okay. Abhishek, your video and audio is on. Thank you. Okay. So next point is confrontation. Confrontation is in this case, a counselor should point out the discrepancy in what the client is saying and what the client is doing. Sometimes in case we can see that client know while gets angry, we should not harm other, we should not throw things, we should not abuse others physically or verbally. They will convey you that they, while in case of person getting angry, they should not do this things. So they know what should do, but in case in case of reality, they are not doing these things. They know we should not harm others while we get angry, but in reality they are doing this purposely. So there is a discrepancy now, what the client is known, what the client know and what the client is doing. That is a discrepancy. So we should confront, we should point out the discrepancy in front of the client, right? Next is self-disclosure. Self-disclosure is like making the self known to others. In case of self-disclosure, you can share your own experience, you can share others' experience, because sometimes people feels that they are very vulnerable position. They are getting they are only who is suffering from this conditions. Okay. Sometimes people think that why this has happened to me, why. Sometimes in case of grief, the people sometimes say that why this happens to me, why my mother is no more. These are the things they are continuously saying. So in case of self disclosure, you can share your own experience, that why, but for that the grief can be reduced, so the catharsis can also occur. Okay, so self-disclosure is very important. In this case, you can share your own experience or your friend's experience or other client's experience. So self-disclosure helps the client to get confidence that he is not only the person who are in this negative position in that situation, right? Okay, so you understand all these points. Is there any question?
No, ma'am.
No. Thank you, ma'am.
Next is assess.
When we explain our self-experience to patient, it is way of or self-experience is also positive, no? Self-experience.
Communicating self is very sometimes it is very positive. What I say that sometimes people are feeling that they are very vulnerable. Okay, they are only the person who is in the negative position. Okay, so this sometimes disclosing some experience help the client to gain some confidence. Okay.
Okay.
Next is on assessment. Next is like after taking case history, after case history, after taking MSc, and after building a rapport with your client, we should move on assessment. Why it is important? It helps us to make a diagnosis of your client. Assessment and diagnosis help a counselor develop an in-depth understanding of a client and identify mental disorders that requires attention. Okay, so there are two types of attention assessment program. First is standardized measure that includes some psychological tests that have standardized norm groups, and another is non-standardized measure such as life history. In standardized measure, for suppose for depression, for anxiety, we can give them for depression and anxiety, we can give them one second. We can give them inventory like big depression inventory. Okay, for anxiety, we can give them big anxiety inventory. Okay, for these are the some psychological basic standardized tests we can give to our clients so that we can get clear understanding. Okay, clear understanding of their current mental health conditions. Okay, and in non-standardized measure, we can take through case history and through open, through unstructured or structured interview sessions method, we can get in-depth understanding about the client. So measurement assessment is very important to make a diagnosis. Diagnosis will help us to formulate the pathology of the client, why this is happening, what are the etiological factors are there, what are the prognostic factors are there. Okay, and these are the these. So this is so these are the importance of doing assessment. Okay. Next is goal setting. Okay. So counseling goals can be conceptualized as a process goal and outcome goal. So process goal, these establish the condition necessary to make counseling process work. Okay, and these goals are related to the issues of formulating the positive relationship by promoting the core condition. When you will see your clients after taking case history, MSc, and after doing the assessment, after formulating the diagnosis, before moving on to the counseling process, you should make a goal, short-term and long-term goal. Okay, so on this, on the basis of the goal, you can it will motivate your client. Okay, you can you will motivate your client. You can evaluate your client's desire, client's expectation from the counseling session. So goal setting is very important. Through the goal setting, you can chalk out the desires and expectations of your client from the counseling session, and the motivational factor, how the client is motivated to rectify, to modify their self. Okay, so in that way you can train your client. Okay, and next is outcome goal. This specify that what client hopes to accomplish in counseling session. Okay, and the outcome goal can be facilitated by behavior change, enhancing coping skills, promoting decision making, improving relationship, and facilitating the client's potential. Okay, so basically main goal of the counseling is to make make the client make the client enough make the client to deal with their surrounding, deal with their own problems. Okay, so we should train our counseling, we should train our clients to make their decision on his own way, to improve their relationship, to facilitate their positive things. In that way they can change their behavior, they can modify their own thoughts. Okay, and they can cope their stressful conditions. Okay, so this should be keep in mind while doing the counseling session. So there are the three main functions that goal setting serve in the counseling process. Already I have discussed that goal setting is very important to evaluate the your client's motivational level, so that in that way you can encourage, you can assign tasks to your clients, and you can educate your clients how to do, how to learn new skill to change their behavior, how to enhance their functioning. So to make a proper evaluation, to get the proper expectations of your client for this counseling session, goal setting is mainly important before starting the intervention, whole intervention process, right? So any query up to this?
No, ma'am.
Okay. Okay, coming to the next. Okay, next is the main thing, intervention thing. Okay, so counselor and client may choose a strategy to implement the form of variety of intervention. There are many types of counseling process: individual counseling, group counseling, couple counseling, family counseling. Individual counseling means only, in this case, only the patient will attend your counseling session. Your focus is on the individual, in the particular individual, on the particular individual is the main focus. In case of group counseling, you can make a group session, okay, group discussion session, where you can call your patients and do a counseling in a group. Okay, couple session, in case the couple counseling session, it will apply for if the clients who have the marital conflict, relationship conflict. Okay, so improve their interpersonal nature, we can do couple counseling. And family counseling, sometimes the family miscommunication, family malfunctioning, sometimes family are communicating in very distorted way, and sometimes parents are very authoritative, parents are very punitive, parents are very strict to their child. So this becomes very stressful to the child, right? So in this case, to change the communication in the family, we can go for a family counseling. So where we can focus on how the whole family members should communicate with each other. So these are the basic counseling times. It will also be covered in future in detail. Okay, so these are the basic counseling types we can choose while doing the intervention. But client also prefer what kind of intervention strategy she needs to apply. Okay, also here the consent of the client is very important before starting the whole process. Consent, you should take the consent from the client about while proceed your counseling session. Okay, next is, after doing some session and implement your intervention techniques, when you understand the client is improving and the conditions, improving from her previous condition, and the client distress levels are reducing, the client can cope with their surroundings, the client can make their decisions. If the improvements are reported by the clients and their surrounding and their family member, you can plan a termination. So termination can be done when clients have worked through their concern and able to proceed forward in their lives without the counselor assistance. Okay, so our main motives is that clients should not be depend on us, should not be depend on their therapist, on their counselor. Okay, so so through the intervention process, we our main focus is that clients should make their things independently, right? So termination should be planned several ways. Abruptly, we cannot terminate our session. So termination should be planned several weeks in advance to provide the opportunity for the client to prepare psychologically. right? So even on the termination session, on the very last session, you should psychoeducate about the relapse prevention. Okay, you should relapse prevention. What is relapse prevention? Because if stressors are increased, if the client is feels stressors, if the client or child get distressed, okay, so the condition, the previous condition may relapse, the depressive episode may relapse, the anxiety episode may relapse, the schizophrenic episode may relapse. So the mental health condition that are deteriorated may relapse if they feel more stress. So we should psychoeducate about relapse prevention, and we should psychoeducate about what have been taught in the whole counseling session. The client should maintain those strategies in their life. Okay, so this will be psychoeducated to the client, and should arrange for appropriate follow-up with the client. You can say your client that after a few months, even in case of emergency, you can follow up, you can take a session and report about your conditions, right? So a follow-up sessions also be suggested. Okay, so understood? Any question? Abhishek, you want to say something?
Uh, and follow-up is very important, I think.
Yes, follow-up is important.
Yeah, because feedback is very important. Because I'm practically, I'm also counselor, so I use this technique. When I follow up 1 month, it's different. When I follow 15 days, it's also different. Same thing.
Exactly. Okay. Okay, so sorry. I am audible now, right?
Yeah.
Next is very important thing, that is Therapeutic Alliance. Therapeutic Alliance. It's a counseling relationship. Therapeutic Alliance, or else it also termed as working alliance. Okay. So relationship that I have mentioned, the relationship between counselor and client is very important. Feeling and attitude that a client and therapist have towards one another, and the manner in which those feelings and attitudes are expressed. So establishing the alliance involves the creation of trust by the patient in the intention and abilities of the therapist. Okay, so the trust is increasingly gained through evidence that therapist wants to be a assistant and knows how to be of assistance of the patients. Okay, so sometimes like even counseling relationship helps the client to build trust and make have faith on their therapeutic process. Okay.
Yeah.
So next, so the techniques by which therapists engage client include what I have said previously, conveying empathy, okay, the unconditional positive reward, and demonstrating the specialized knowledge, because they are unknown about their condition. So sometime while starting the therapy session of a counseling session, you should psychoeducate your patient about their current condition, about their diagnosis, about the etiology of their conditions, and about the some factors that may increase their current condition. Okay, so we should provide some knowledge about their condition. Okay, so we should psychoeducate our client. Okay, and lastly, we should make a effective suggestion so that the client can work on the suggestion to get a better outcome. Okay, so here trust, showing convey empathy, showing unconditional positive regard, showing respect is very essential to build a therapeutic alliance. Okay, counseling relationship is very important, very much important. It create a secure base. Okay, it create a secure base, right? So a secure base that counts if counselor act as a secure base from which client can explore and check in with. Okay, so this is the very important things to get better outcome from the counseling process. Okay. Okay, so coming to the next thing that is very important. This question was asked in last, is the difference between counseling and psychotherapy. Okay, so counseling and psychotherapy almost similar because those both of them are intended to reduce the distress level in patient, right? So and make and facilitate their facilitate their own resources, positive resources, and make them able to cope with their surroundings, with their negative situations, right? So these are the common goals of counseling and psychotherapy, but there are some other differences exist. Firstly, I read that counseling is indicated for short term and less serious problem, while psychotherapy is indicated for long term and much more chronic psychological emotional problem. In last class, sir also mentioned that for counseling, anybody can come for counseling, take counseling session, because if they feel distress for any reason, for their work related stress, for their academic related stress, any kind of stress, if they are dealing currently, so they can come to take counseling session because it is very short term, and sometimes it is this problem, right? But psychotherapy is very long term. It will take some time, more than 10 to 12 sessions, but counseling can be over 8 session, 5 to 8 session. Okay, and counseling generally give direct suggestion. In case of counseling process, we are giving direct suggestion, but in case of psychotherapy, the in-depth intervention is needed. In case of psychotherapy, our actual intention is that to make the client their own therapist. Okay, so if to be a own therapist, be a independent, you should understand your problem in depth. Okay, so that if you understand your problem very deeply, then you can use your own strategies, your own resources to deal with their problem. So while making the person capable to uh, doing this thing in that way, so we may execute some strategies. Some psychotherapeutic strategies are there, but in case of counseling, we are giving direct suggestion, direct advice. But in case of psychotherapy, we are trying to avoid that. We are trying to gain insight in the patient, right? And counseling deals mainly with basic life problems. What I already mentioned that anybody who are suffering, who are undergoing any stress due to their academic problem, work related problem, right? So basic life problem that most people experience at one time or another, as work stress, relationship problem, and any life transition. Sometimes the patient are migrated one side, one area to another, so it is very difficult for them to adjust with their new situation, right? And so in this case, we can provide counseling, but psychotherapy is a greater area, focus on greater to improve the problem and their underlying thoughts, beliefs, and emotion. In last class, I already mentioned that uh, our thought, emotion, and behavior has interactive relation, interchangeable relation. If we perceiving our situation in a very distorted manner, then our thought become negative. right? If we are perceiving our situation very distorted manner, if we are maximizing the negative aspect of the situation and minimizing the positive of that situation, then we are analyzing, interpreting the situation in a very negative manner. So our thought become negative, and thought influence our behavior to behave in a maladaptive way, and our negative thoughts also influence our emotions, so that we are feeling more guilty, more disturbed, more distressed, more disgust, more fear related symptoms will be emerged, right? So we, in case of psychotherapy, we are trying to modify our thoughts, so in that way we can change our thought, change our belief, change our maladaptive behavior. We can regulate our emotion also. Okay, so that counseling is very directive, while psychotherapy is less directive, right? And counseling is more often provided in outpatient setting, but psychotherapy provided in both inpatient and outpatient setting. Okay, and counseling is more emphasize on change, while psychotherapy emphasize on to generate insight about their negative thoughts, about their dysfunctional assumption, about the reason behind symptom manifestation, about the maladaptive behavior, what are the antecedents of maladaptive behavior, and what are the consequences of maladaptive behavior. If they get proper insight about the antecedent and the consequence of maladaptive behavior, they regulate their behavior, they can regulate their emotions, they can regulate their thoughts. Okay, so we should, in case of psychotherapy, we should emphasize on the insight generation, but in case of counseling, we are mainly focused on change. So in the counseling session, we are giving direct suggestion, direct advice to change their current situation, not situation, change their current behavior, thoughts, and emotion. Okay, so these are the basic counseling and psychotherapy process, and this is all about the differences. Okay, so is there any query?
No, ma'am.
Madam, I have one question.
Yes.
Yeah, if I am not wrong, you are just telling that in psychotherapy part, the patient, he or she will act as his own therapist. Is it, ma'am?
Yes. We are train the patient that in future they can act, that they can handle their own things, they can handle their own negatives, own their things as they have been taught during their therapy session.
Okay, ma'am. But in one case, I just want to say, if the patient is an autistic one, and here I have found that they are going for counseling and all, as well as in psychotherapy.
Okay.
And in psychotherapy part, how can they do that same thing? Is it possible for?
No, in case of autism, being a psychotherapist, being a clinical psychotherapist, our main focus to train their caregiver to how to manage their child, because autism has many significant problems like social communication problem, many repetitive behavioral problem. Okay, so autism has their own autistic world, own autistic thinking. It is a very special neurodevelopmental condition. So in this case, the caregiver how to handle their child. Even in case of intellectual disability, their caregiver how to develop some desirable behavior and how to decrease undesirable behavior. So in this case, we use behavioral therapy to and teach their caregiver how to handle your child, how to handle maladaptive behavior, how to modify maladaptive behavior, how to decrease maladaptive behavior, and how to increase desirable behavior. Okay, so these are the approach.
Okay, ma'am. So, in case of autism, psychotherapists mainly educate the caregivers to be for the betterment of the patient. Okay, ma'am. Okay, thank you very much.
In case of autism, actually psychologists are following the theory of mind. Okay. Theory of mind, that is the most important issue in case of the autism. So please you study the theory of mind, and theory of mind is very important, particularly for the psychological counseling. Okay?
Yes.
Thank you, sir. Okay, sir.
Okay. Next, I have a question for you all, that we have already covered the basic psycho counseling approach. So I would like to hear some words from all of you, that what is the importance of Therapeutic Alliance in counseling? Okay, so tell me about your understanding about the importance of Therapeutic Alliance in counseling session, and how will you build rapport during the counseling session?
Ma'am, can I explain in English, Hindi?
You can explain. If you're comfortable in English, then you can say in English. Otherwise, you can say in Hindi also. Hindi is understood understand by all.
Yes.
Okay, Abhishek, continue.
पिछले साल मई में मेरा कोरोना काउंसलर के लिए रिक्रूटमेंट हुआ था। तो आपको सिचुएशन तो सभी को पता थी। तो उसमें एक पेशेंट थी मेरे पास, तो काफी मतलब मींस वो डिप्रेशन में थी, कोविड में डिपार्टमेंट आईसीयू में था मेरा ड्यूटी। तो अब प्रॉब्लम ये थी कि वो लेडीज थी और ना मैंने उसके बारे में सारी हिस्ट्री ले ली थी। तो वो पता चला उसकी हिस्ट्री में सब पता लगा कि वो वहाँ की मतलब अच्छी डोमिनेंस थी। तो उसका जो आपने बताया ना बिहेवियर, इसको मैंने अप्लाई किया था। उसका बिहेवियर देखा क्या है, फिर उसको मैंने मतलब उसका, क्योंकि इसमें कास्ट भी थोड़ा मैटर करता था, तो बताया कि भाई मैं राजपूत हूँ और हमारे यहाँ ऐसा वैसा होता है। तो मैं ठीक है, मैंने कहा जो तलवार चला सकती है, जो मतलब बच्चे पैदा कर सकती है इस तरह से, तो वो काफी कुछ कर सकती है। तो उसका बिहेवियर को देख देख के उसमें क्या चेंजेस आने लगे अच्छे, और कॉन्फिडेंस फील होने लगा उसको। हेलो,
यस अभिषेक।
हाँ, तो उसको मतलब उसका बिहेवियर चेंज आने लगा, उसको काफी कॉन्फिडेंट आने लगा। तो मैं उसको मतलब थोड़ा मेरा के पॉइंट स्ट्रॉन्ग था नॉलेज वाइज। तो मैंने उसको बताया कि आप जब इतना सब कुछ कर सकते तो आप काफी कुछ इसको, ये कोरोना आपके लिए कोई बड़ी बात नहीं है। क्योंकि वो उसके घर वाले, उसका जो वो लेडी तो बहुत स्ट्रांग थी, लेकिन उसके जो घर वाले उसको बहुत प्रेशर दे रहे थे कि अब हमारा क्या होगा, तुम नहीं होगी तो क्या होगा। तो इस तरह से मतलब मैं उसको थोड़ा हिस्टोरिकल बता रहा था कि जब आपने हॉर्स राइडिंग कर रखी है, आप तलवार चला सकते हो, तो आप काफी मतलब हालांकि एक नॉर्मल पर्सन टू पर्सन वेरी करता है पेशेंट पे। तो उसको मैंने मतलब थोड़ा हिस्ट्री के बारे में बताया, थोड़ा मैं राजस्थान से था तो मैंने मेवाड़ के बारे में बताया, कर्णावती के बारे में बताया, और कॉफी झांसी की रानी के बारे में बताया। मैं जब ये लेडी जितना कर सकती तुम तो खुद भी उसी से हो। वो बताई थी कि उसने बताया कि मैं जाडेजा फैमिली से हूँ। तो मैंने कहा आप तो आराम से फाइट कर सकती हो, और उसके बाद आप जाके लोगों को और बता सकती हो। उससे उसको काफी मतलब कॉन्फिडेंट फील हुआ। मुझे पता नहीं ये टेक्निक, वो तो ऑन द स्पॉट उसको सिचुएशन तो वो देख के और थोड़ा प्रेजेंस ऑफ माइंड मैंने अप्लाई किया था इसको।
So you were just trying to enhance your client's motivation by focusing her positive attributes, right?
Yeah.
Very nice. So what are your understanding that Therapeutic Alliance का importance in counseling?
मैं तो इतना जानता हूँ कि मतलब मैं एक्चुअली उस सिचुएशन पे डिपेंड करता है एक्चुअली, प्रेजेंट उसकी मेंटल कंडीशन क्या है और इन्वायरमेंट किस तरह का, क्योंकि उस समय इन्वायरमेंट काफी चेंज था और चारों तरफ, क्योंकि उसके आसपास एक दो जने जा चुके थे मतलब कोविड में। तो उसको उस सिचुएशन को ध्यान में रखते हुए इवन 2-3 बार मैंने झूठ भी बोला। उसने मुझे पूछा था कि वो पैकिंग हो, क्योंकि वो मेंटली थोड़ी तो प्रॉब्लम हो ही गई थी उसको। कि ये पैकिंग कैसे हो चुकी, मैंने बताया कि नहीं वो तो उसका बॉडी नहीं है, वो तो उसका सामान है। तो क्या उसमें नाम लिखा है, मैंने कहा वो सामान गुम ना जाए, इस वजह से हमने उसका नाम लिख रखा है इस तरह से, ताकि वो काफी मतलब कॉन्फिडेंट रहे, उसको ये नहीं लगे कि मेरे आसपास वाले चले गए और मेरा भी कुछ हो सकता है ऐसा।
Okay. Anyone else?
That's all.
Ma'am, as we have now understood about Therapeutic Alliance, that it is done by conveying that empathy and demonstrating knowledge and making effective suggestions. So it actually has an importance in counseling also, as if the counselor will be giving a non-judgmental attitude, the warmth, the respect, that the reassurance that all will be okay, saying those common words that sab theek ho jayega, everything will be fine, and especially the counselor will show that willingness, that yes, he is there to listen each and every point, even it's minute or even it's big. So that will actually help the client to make that trust build, and that's why it's important in counseling.
Okay. Okay. Very good. Okay. Anyone else?
मैम एक बात और कहना चाहता हूँ, आई कैन यूज म्यूजिक थेरेपी ऑल्सो, मीन्स म्यूजिक इन्वायरमेंट, and also think that I find out the patient's the mother tongue, because his mother tongue is also effect, because their confidence is built when we talk about their mother tongue. That's my opinion.
Okay. Very good. Very nice. Okay.
Madam,
Huh.
Madam, can I say something?
Yes, obviously.
Yeah. Actually, when you are talking about the importance of Therapeutic Alliance in counseling, can I share my some personal experience in that to have a conclusion? Actually, I do work with some autistic children. And in a renowned psychiatrist, under his guidance actually, and there I found that I do work as movement therapist there, and I think that it is really very helpful, as my previous person says that music therapy, I do work in movement therapy. It is very good to have a therapeutic intervention to make the person comfortable to others, and make a feel free attitude, and it is really very helpful, as you said in your presentation, that at first the patient should feel a homely atmosphere to disclose his own inner feeling before anyone else, to disclose his mind setup and anything else, to have a comfort zone. It is very helpful to have the performing arts as a therapeutic intervention. It is madam, I think it is more helpful, because when we work in a group, there is a counselor, there is a psychotherapist, there is a speech therapist, there is a occupational therapist, and others also. But they first now tell me that, Orpita di, you just do one or two sessions with this little boy or little girl. After that, they will enjoy our presence, and then they will come to our side and they will listen to us. So now the first the situation is there, they go to others and then come to me, and now the situation is like that. They just, before a therapeutic session, they just try to enjoy with me, having music, dance, and everything else. And after that, we are going actual the focus based sessions. So in my opinion, Therapeutic Alliance is very, very much important for making a goal setting and to initiate the proper counseling. Is it true, ma'am?
Absolutely, absolutely. You convey your understanding very good way.
Thank you, ma'am.
Actually, in case of the autism, you have to think about the deficit in reasoning level. That is called the theory of mind. So you have to design some of the play materials or training program in such a manner so that So this, in case of this autism, you have to think about the theory of mind. Okay.
Sir, I
And
will definitely.
theory of mind, it deals with the deficit in reasoning level. So autistic children, they have the problem, they have the difficulty in reasoning. So what is important? You have to design the training program or the intervention program in such a manner so that the children can develop the specific type of reasoning related to his or her regular life. Okay. So theory of mind is very important in case of managing the autistic children. Please read the theory of mind.
Okay, sir, I will definitely read, and I will request you to guide me in such a way so that I can work better. And it is very. I just want to share one more words. Actually, I love this subject because of Dr. Datturai. He was the man who means who taught me to how to love psychology and do some work related to it. Thank you, sir.
Okay. So we are ending our class here today. We will have our next class on coming Sunday, 8 p.m. to 10 p.m. Okay.
Ma'am, I have one request. If it is possible, can you share your slide in our group?
Yes.
Actually, you are giving the YouTube link there from yesterday, the day before yesterday. You also gave. But if possible, can you share the PPT
Yes.
of Sunday also? Because
Yes.
last Sunday I had a very bad network issues. So please, if possible, ma'am.
Okay. Okay.
Thank you, ma'am.
Thank you, ma'am. I have joined today a little late. Yes, ma'am. But I will follow the class schedule from Sunday, definitely, ma'am.
Yeah.
Yes, ma'am. Thank you.
Okay. Okay. Okay, sir. We are.
Okay, please close your hands for the prayer. Om Purnamada Purnamidam Purnamudachyate Purnasya Purnamadaya Purnameva Vasishyate. Om Shanti Shanti Shanti. Okay, good night, everybody. If you have any question, please you write in the group. Okay. And
Yes.
please you confirm the research internship. That is very vital. Please do not take much time because within 2 months you have to finish the research internship. Okay.
Okay.
Okay, thank you, sir.